And I am joined here by you are our first live guest. We
Oh,
changed our whole set here on Unscripted on 13 Plus,
oh,
so welcome.
thank you so much for having me here.
Of course. So it is Women's Health Month. I know it's the last day of May, but we think it's important to for women, honestly, to care about their
Yeah.
health, to be vigilant about their health year round. So go ahead and introduce yourself. You're from Arizona Oncology.
Yeah, I'm Dr.
Perfect.
Shobna Talukdar. I'm one of the GYN oncologists at Arizona Oncology, and I'm here to chat about gynecologic cancer and the services we provide and spread the message about screening and treatment and prevention.
Absolutely, so important.
I
So,
know.
as I mentioned, it is kind of the end of Women's Health Month, but something that we really need to be vigilant about
Correct.
year round. So,
Correct.
as a woman, anybody who's listening at home, mothers for their daughters, what do women need to know for their health? Something that they do every single year.
Yeah. I think the most important, it's very important because a lot of these cancers are very subtle and the symptoms are vague and you can easily dismiss those symptoms. So I would always suggest them to be attuned to your body and listen to these very carefully the symptoms, and if the symptoms recur or persist, please visit your healthcare professional and get screened. And
Yeah.
for the daughters, I would say people who at least a woman who at least at age 21 and above, please get your PEPS test and your routine HPV vaccinations from age 9 to 12, and now it's been extended to 26 to up to age 45.
Wow.
So do get screened and get those vaccination. Cervical cancer is absolutely preventable, and for other gynecologic cancers, right, ovarian cancer, you have to just listen to your body and watch for those symptoms.
Yeah.
And for uterine cancer, which is the most common cancer in GYN oncology, you have to report your doctor if you have any amount of bleeding after menopause or
Okay.
any irregular bleeding during your menstrual reproductive years. And I always tell my patients, any amount of bleeding is abnormal, whether it's a spot, stain, pink spot, brown spot. Sometimes people ignore those, but never ignore those symptoms and visit your doctor.
Okay. So these regular screenings, are they once every year? Are they more than that? Or how often should women really be kind of paying attention to when they're going to see their doctor?
So it depends on their prior health condition.
Okay.
Regarding cervical cancer screening, if a woman between age 21 to 30, they typically get pap smears every 3 yearly. And after age 30, we typically extend it to 5 yearly, and we either patient has three options. They can go for routine pap smear every 3 yearly, or they can do a co-testing with pap smear and human papillomavirus testing, which can be every 5 yearly, or just they can do a HPV testing. So it all depends. The frequency depends on the prior health history and their risk factors. So sometimes we see them more frequently than usual, depending on their health history. So,
Okay.
and they can have a chat and discussion with the doctors regarding how frequently they should be seen.
Okay. So speaking of family history, let's say somebody knows that their mom or their grandma had certain female cancers. What should they do? Should they be seen more often because of the family history, or is it just a conversation to have with your doctor?
I think they should have a discussion with the healthcare professional.
Okay.
I always say it's very important to know the family history of cancer history, especially. And if they are at higher risk based on their family history, they should see a genetic counselor, and their primary care provider or gynecologist can help them get a link to the genetic counselor. And if needed, indicated, they will get to a genetic testing, whether it's a blood test, saliva test, and we can provide them that education and guidance they need.
Okay, we've had several doctors on from Arizona Oncology, and something that I feel like is the message with everyone we've spoken to is the
Yeah.
importance of early testing, catching anything as early as
Correct,
possible.
correct.
Okay.
And earlier is better because you can treat a lot of these cancers, you can cure them. And as I want to spread the message that most of these cancers are preventable and curable, and if it's caught early. And that's why please visit your doctors and get them checked.
Is there any other signs besides abnormal bleeding that people should be aware of?
So symptoms vary by the type of cancer.
Okay.
Ovarian cancer is referred to the cancer that whispers, meaning a lot of these symptoms are very vague, right?
Okay.
Like you can have abdominal bloating, fullness after a small meal, or frequent urination, or
Okay.
change in the bowel habits. A lot of, as I said before, we can easily dismiss those symptoms. Because of our aging or gaining weight, you
Yeah.
can easily attribute to other causes. But if it's more persistent, like it's coming frequently and it's persisting for more than 2 weeks, you should definitely visit your doctor and seek guidance.
Okay.
Uterine cancer, which is the first most common cancer, patients typically present with bleeding. It's
Okay.
irregular bleeding or bleeding after menopause. And we can diagnose this cancer by providing an endometrial sampling, which can be done by a regular gynecologist or a cancer specialist, and it's an easy office procedure. For cervical cancer, we typically, to screen them, we do pap smear testing along with HPV testing. And also they should have a regular pelvic exam yearly, even they are not getting pap test.
Okay.
So to diagnose all these cancers.
Okay.
And for vulvar and vaginal cancer, this is the rarest cancer. Any amount of vaginal itching, lump, bump, whatever you notice, please report to your doctor. Don't
Okay.
ignore those symptoms.
Anything else we didn't mention that you'd like to highlight?
I think these are the most common ones. I also would say there are some rare type of cancers. These are not very common, but we have seen them more often in certain communities like Hispanic or Black communities. So they always should report to the doctors, get screened, because most of the time, even its early stage, it can be very aggressive. So those are the cancers that are, although not common, but I think they can be a little deadly. So it's always important to keep an eye and have a look out for those symptoms.
Okay. Thank you so much for joining
Welcome,
us.
welcome
Yeah,
for having me
thank
today.
you.
Yes,
Of course.
it's nice meeting you.
And